Hi, I'm Dr. Neeraj Jain. I'm a pediatrician with expertise in cardiology. I'm based in London and today I will be talking about heart murmur in children. It's a very common occurrence in children and many parents they contact me as they are worried. So I will be talking about what are the heart murmurs, their causes, and when could they be of some concern. So when we talk about heart murmur, it's an extra noise which comes from the heart. It is usually heard when you listen to the heart with a stethoscope. It is generally described as swishing or whooshing noise when we listen to it with a stethoscope. There are various reasons for heart murmur, and the two main categories I would talk about is innocent heart murmur and pathological heart murmur. When we talk about innocent heart murmur, generally it comes from a normal heart and it appears due to excessive blood flow or turbulence in the flow of blood flow. For example, if child has fever, if child has anemia, or they are unwell or after excessive physical activities, physicians they can hear this extra noise in their heart. Whereas when we talk about pathological murmur, generally there are some concerns. For example, some structural heart problem, which may be a congenital heart problem. Many people they think about hole in the heart. We call them as septal defect or any valvular defect. In addition, they might be acquired, for example, infection like rheumatic heart disease, which is becoming increasingly uncommon in this country, but still we find some cases of heart murmur or some heart muscle disease, which we noticed around the time of COVID infection as well. So, how do we diagnose these heart murmurs? The way to diagnose the heart murmur is by performing an ECG. ECG is electrocardiogram, although directly it is not related to diagnosing the heart murmur, but it can tell us so many things around the heart. Another investigation is echocardiogram, which is like a pregnancy jelly scan. When we put jelly on a child's chest and we take pictures of the heart, it is called as echocardiogram. So I perform this echocardiogram very frequently and we try to find out if something is structurally wrong with the heart or not. How do we manage the heart murmurs? If we talk about innocent heart murmurs, they generally don't need any treatment, and most of the children they grow out of it as they grow older. As the heart is structurally normal, when we diagnose them as innocent heart murmur, they do not require any further follow-up in this matter. However, the pathological murmur, the management depends on the underlying cause, which includes treating them with some medicines and even correcting them surgically. It is important that heart murmurs are properly investigated and diagnosed in either way, whether they are innocent or pathological, and early detection of heart murmur is crucial so that early action can be taken and further deterioration in the health could be avoided or minimized. Thank you.